Okay, welcome everybody. I am going to be showing you how to do a castor oil pack on your lower abdomen today. So I'm not going to actually be putting it on myself because I would have to be laying down and it might just be a little bit confusing, but I'm going to talk you through the whole process, and I will also provide you with a PDF of all of the directions and some specific conditions that you can use a castor oil pack on your abdomen for. So I will just start with saying that it can be really helpful for reducing scar tissue and any adhesions. So particularly for people that struggle with endometriosis or cysts or fibroids, for example, women that experience those things can really benefit from castor oil packs regularly. Also, if you have pretty substantial period pain or even a little bit of period pain, it could be really useful for that as well, to alleviate that. So the way that you do a castor oil pack, different people kind of do it different ways, but you'll start with a castor oil that you like. I typically get organic castor oil. I put it in this separate bottle. I like the pump to make it come out at least a little bit more easily than the squirt bottles, but that's just my preference. So you can either just squirt it directly on your hand and rub your hands together and rub that directly onto your belly. The other option that a lot of people go for is to soak their flannel. So you'll need some sort of flannel like this. So I've already soaked it in castor oil. So it shouldn't be like sopping, dripping wet with castor oil. It should just be like pretty saturated. And then you can store it in a glass jar. So this is a ball jar and there's a lid. So you can do that and then continue to reuse this one for a variety of sessions. So once you do that, then you'll place that entire flannel onto your belly. And then you'll cover that with either, I usually use a washcloth. So I would have flannel, washcloth, then, or you can also use plastic wrap. There's something about plastic wrap that just never resonated with me. A lot of people do that. They talk about it like holding in the castor oil better and all of that, but something about putting plastic wrap on my skin just didn't feel right to me. So I always use a towel, washcloth kind of thing. And then you use some kind of heat source. So I really like using a rice pack rather than using a heating pad. Just not having something that plugs in just feels more right for putting something over your womb. So you can heat these in the microwave if you have a microwave, but if you don't, you can also heat them in the oven. So at 200 degrees Fahrenheit, you would just put it in for like 10 or 15 minutes, and then that would be warm enough. And then you'll just check the temperature to make sure it's comfortable. So again, you'll have the flannel that's been soaked in castor oil, then you'll have your washcloth or plastic wrap, and then you'll have the rice pack that's been heated. And then after that, you can also put a heavy towel over that. And that's just kind of to put a little bit of additional pressure in the area. It feels really soothing and cozy. So you can do that. And that is pretty much it. That's all a castor oil pack is. The only times that you can't do it are if you are currently pregnant, or if you've had any sort of abdominal surgery, like if you had a C-section, for example, you would want to wait for at least 6 weeks before performing a castor oil pack. During your bleed, it's kind of up to you. Some people think castor oil packs feel really good. Other people advise not to use castor oil packs because it does have a tendency to increase your bleeding. So especially if you're somebody with fibroids or endometriosis, it's really useful to break up that scar tissue and those adhesions. But you also have to be careful that you're not increasing the blood. So it's always kind of like a delicate balance of getting things moving, but not being too much that you're getting depleted in the process. So that's pretty much it. You would leave that on for 20 to 30 minutes. You could leave it on for longer than that, but 20 to 30 minutes is a good place to start. Definitely if you started having any symptoms, digestive or otherwise, you would want to reach out to some kind of practitioner. You could certainly reach out to me and ask me about that. And then you would do it 2 to 3 times a week for a period of 3 weeks, and then you take a week off, and then you start that cycle again, and you do that for 3 full cycles. So for 3 full months, you would do 2 to 3 times a week for 3 weeks in a row, and then take a week off for 3 months, and then you would kind of reassess from there if it's something that you are going to continue doing. And that's it.